Hi there, my name is Carter Munson, and this is the first of a series of 4 videos on the bones and bony landmarks of the human body. I decided to make these videos to help you out because the bones and bony landmarks are an often underlooked or overlooked part of human anatomy, and they're actually very important not only in your studies but in clinical practice as well. So oftentimes I see that students are so caught up in lab with actually looking at the cadaver, studying there, or even in open labs, that the last thing on their mind is to look over bones. It seems so easy. So instead what we're going to do is these videos will be accessible to you at any time. So you can always, whether it's midnight or in the middle of the day, you don't have to go to the library or try and sneak into an open lab hour, and you can learn the bony landmarks from the comfort of your own home. So we're going to get started with the first unit, which is the lower limb, bones of the lower limb. Alright, so we're going to start off with the coxal bone, or the hip bone, and to set the tone for the rest of the videos, where we're going to be starting the most proximal portion of the bone and then moving distally. So this is just a full-on view of a full pelvis with both coxal bones surrounding the sacrum. So this is just to help you get an idea of how we're going to orient these bones. It's no matter what you're doing in anatomy, especially with bones, you want to orient yourself properly. So we'll go back to just one bone right here. And first off, what we're going to do is this portion of the bone, which is called the pubis, is going to be the most anterior. Then, as soon as you get that all aligned properly, the rest of it just kind of comes into place. As you can see, this part of the ilium will actually be forming a sort of bowl shape. So that's just a good way of thinking about it. So we'll get started. Now, the coxal bone is comprised of 3 separate pieces. That'll be the ilium, which is this whole portion right here, the ischium, which is right here, and then the pubis. So starting with the ilium, there's a few landmarks we want to be aware of. The first, which is the major one, will be the iliac crest. This is very important to know for clinical anatomy. When you're in clinical practice, this is oftentimes where you can also find some surface anatomy. You can feel it really easily on your hip there. So moving anteriorly, if we follow this, we see this first protrusion right here. Now this is called the anterior superior iliac spine. Anterior because it's in the anterior portion of the ilium, and it's also high up, it's the most superior portion. So anterior superior iliac spine. We'll move just inferior to that, and we'll find the aptly named anterior inferior iliac spine. Then again, if we want to look posteriorly, right here, we'll see the posterior superior iliac spine. And those are the major ones we want to be aware of. So now we're going to look at both the 2 surfaces of the ilium. First, we're going to look on the outside surface, right here. So the outside surface is called the gluteal surface. Gluteal is because that's where your gluteal muscles are going to attach, and if you need help knowing that that would be on the outside, I think it might be kind of tough for you to, it should be that hard to figure out. So there's 3 features on the gluteal surface of the ilium that are hard to see on the video. They're hard to see in real life. You can only really tell by feeling it on the bones, and you're only going to feel these on a real bone. The first, they're called the gluteal lines. There's a posterior, anterior, and inferior. The posterior you're going to feel right around here, kind of posterior and most superior portion of the bone. Then the anterior gluteal line, going to be just below that. It's going to run right up here, moving close to the anterior superior iliac spine. And then finally is going to be the inferior gluteal line, which is right here. And again, it's tough to see and tough to even feel sometimes. So now we're going to flip back around, finish off with the internal part of the ilium. And this is the iliac fossa. There's actually a muscle called the iliacus that will run intimately with that bone, that portion. And then we'll finish up with this rough portion. And the rough parts, anytime you see a rough part, it's going to be what we call a tuberosity. And this is basically where tendons or muscles will typically attach, right here. And this is called the iliac tuberosity because it's on the ilium. Just below that, right here, there's a surface, and this is called the articular or auricular surface of the ilium. Articular because it's, as we can see, right here with the sacrum, this is the part where the coxal bone articulates with the sacrum. It's also called auricular because it's kind of, ear-shaped, and we'll see this through numerous other parts of anatomy, both bones and tissues, that there's a lot of things made of your ears, auricles. So we're going to flip this bone around, and we're going to start moving more inferior. And as we see, another portion of the ilium, this really big notch right here, is called the greater sciatic notch. This is really important in clinical anatomy. This is where the sciatic nerve exits from the lumbosacral plexus and it provides a lot of innervation to the leg. Oftentimes it's a site of pathology, and you can actually palpate this in the clinic, and you can notice any tenderness, and it's helpful. So as we travel on down from there, we run into another protrusion, another spine, and this is called the ischial spine, as it's part of the ischium. This would be considered the ischial spine, and it separates the greater sciatic notch, right here, from the lesser sciatic notch. So that's just a helpful way of knowing what that is. Then we're going to get into the body of the ischium, which would be this portion right here. You can see. Then, on the body of the ischium, you see another rough part. And this rough part is, again, we're looking posterior right here now, looking from a lateral angle. This rough surface, again, it's a tuberosity, and because it's on the ischium, it's going to be the ischial tuberosity, so that makes sense. Now, we are going to continue on down around here, and this portion will be considered what we call the ramus of the ischium. From the ramus of the ischium, it then runs into the inferior pubic ramus. Now, at that crossover, which is right about here, this becomes the pubic, or the pubis portion of the coxal bone. So we have the inferior pubic ramus that will then loop back up, and we have a little protrusion here. And this is this little bump right here. You can feel it, you can see it. It's called the pubic tubercle. Now, sometimes you're not going to see this in your netter if that's what you have, but there's another important feature called the pubic crest. Now, basically you go from, we're looking anteriorly now, as you can see what we're looking at, right? Here's the pubic crest, or pubic tubercle, I'm sorry. And there's the pubic tubercle. You're going to go medial, and this will be the pubic crest. Right there, right next to the pubic tubercle. And you can see it's on that one as well. Now, we'll continue on back posteriorly, and this will be the ramus, the pubic ramus, the superior pubic ramus, I'm sorry. Superior pubic ramus, inferior pubic ramus. And then the last two features on the hip bone that we want to be aware of is this big hole, which is the obturator foramen, as you'll see throughout the rest of your course. Anytime you have a hole, it's typically called a foramen. Foramina is the plural, foramen is just the singular. So this is the obturator foramen. In vivo, you're going to see there's going to be you're not going to see it, but there's a membrane that covers this, which allows nerves to pass through. And then finally, we have this deep pocket, which is called the acetabulum, and this is where the head of the femur will actually articulate. You can see like that. Provides a really stable base for the lower limb. Now we're going to move on distally to the femur. As you can see, this is the biggest bone in the body, and we're going to orient ourselves to this as well. So the way to orient yourself with the femur is you find the head of the femur right here, and this is going to be medial. Again, if we're looking at our pelvis, our femur is going to, the head of the femur is going to latch right in to that acetabulum. So this is going to be on the medial side of the body. And then if you want to look lower, what we see is, we're going to flip it around posteriorly, you'll see this kind of pocket, this indented area. It's pretty smooth, and it's only going to be on the posterior side, and that is called the popliteal fossa. Lots of major vessels will actually run through here. You can feel this and see it on the back of your own leg if you want. So this is just a kind of way to help orient yourself. Lateral, medial, superior, inferior. All right, so starting with the head of the femur, we're going to move laterally, and this portion will be the neck of the femur. It's very important. We'll continue laterally, and we'll run into the greater trochanter of the femur. The greater trochanter, you can actually feel on yourself if you palpate around. You can feel that right below your hip. Now, in order to find the lesser trochanter, we're going to have to look posteriorly. So now we're looking posterior. Still, this is now the medial side. This is the lateral side. And you'll find the lesser trochanter. It's a lot smaller, obviously, than the greater one. Now, there's two other features that we're going to find between these two trochanters, called the intertrochanteric crest, and then anteriorly is the intertrochanteric line. Now, you can either memorize that if you want, or a way that I find that helps is looking at the trochanters. You can only see them well, both when they're looking posteriorly. And I think of them as kind of like mountain peaks. And so you have these two mountains, right? And between them would be a ridge. And it's raised. You can definitely tell that hopefully on the video. You can see that and feel it when you're looking at the bone. And because it's raised, we'll call it a crest. So intertrochanteric crest. Anteriorly, you don't see that raised. I mean, you can see sometimes like a dark, or you can feel it, there's something there, but it's certainly not raised to the extent of the crest. So that's the intertrochanteric line. Now, we're going to look posteriorly again. That's where we're going to find some other important features. Looking from the greater trochanter, and we're going to start moving distally. You can kind of feel a rough spot. You can see a rough spot here. Now, that is another tuberosity, of course. And this one is not named for the bone it's on, but it's named for what attaches to it. This is called the gluteal tuberosity. Gluteal tuberosity because the gluteus maximus muscle actually attached right there. So it makes sense. So that's right here. Now, we're going to go back medially to the lesser trochanter. And what we can see from the lesser trochanter is there's this kind of a little ridge that starts moving distally, right about here. That little ridge is a line, and it's called the pectineal line. So that's actually called pectineal line because the pectineus muscle, which is hard to see it actually attach, will attach there. And then the final line we're going to see on the femur is just distal to both of those. You can kind of see a V start to form right here. And then they connect, and it goes down. That little V is actually rough, and hopefully you can see it on the video, is known as the linea aspera, which actually means the rough line. And so, as you can kind of see, it's a rough sort of line. And it comprised of 2 lips, but you don't need to worry about that. We're going to continue on the posterior side of the femur. And we again have the popliteal fossa, which is important where for various vasculature and nerves actually run through. We'll flip over, or back anteriorly, and you can see right here, you can see the patella. Now, I'm going to move to a different femur. We can see without the patella. So obviously, this is our patella, your kneecap, which you can feel. We move that out of the way, and we can see something a bit easier here. Again, this is a bit different now. Medial side, lateral. We have these 2 little, I usually call them heads of the femur. They're actually called the medial and lateral condyles. These condyles, we'll see them on the tibia and also in the forearm or the upper limb, are basically these little protrusions here. Medial, it's on the medial side, lateral on the lateral side. Just above them, which is sometimes hard to see, it's more of just a region, would be the epicondyles. Epi meaning on top of. So we have the lateral condyle right here. We move superior to that, the lateral epicondyle. Look medially, you have the medial condyle, and then superiorly, the medial epicondyle. One more little piece on the medial condyle. Again, looking medially, you only see this here. There's a little bump right up by the medial epicondyle. That little bump is called the adductor tubercle. Now it's named that because A, it's a tubercle, it's a little protrusion. But again, we're looking on the medial side of things. This is where the adductor muscles, some of the adductor muscles will actually attach from starting up here, and then they'll attach distally. And that allows for adduction of the lower limb. So again, if we'll look at our little handy pelvis, abduction, abduction, meaning to take away, going way out here. Adduction, you're adding back to the midline, so you're coming back. So for a muscle to be an adductor, it's got to be on the medial side, right here. So it can actually take that bone back to the midline. So that's where it gets its name, the adductor tubercle. Finally, where we saw the patella, which would be right here, on this anterior portion, the smooth surface is called the patellar articular surface. It's where the patella articulates, the joint. All right, so now we're moving on to the leg proper. So the actual, what we consider anatomically as the leg, is comprised of the tibia and the fibula. Now the tibia, again, is the most medial of these 2 bones. So visualize yourself. Here's our medial side, here's our lateral, superior, inferior. Superior is always going to have these condyles. So we'll start with the tibia. Now, just for a point of reference, here's the femur as it would articulate with the tibia. So we see those lateral medial condyles of the femur will articulate on the medial and lateral condyles of the tibia. So that makes sense. Now, there's no technically epicondyles on the tibia, but what we'll see here, where these 2 screws are actually sticking out, is this little prominence right here. And that prominence is called the intercondylar eminence. And so it makes sense if you think about it. It's between the condyles, intercondylar, and it's emanating from the bone. So now we're going to move slightly inferior to that. And you'll see this V, this upside down triangle. And it's got a rough spot, rough patch. It's another tuberosity. And this is the tibial tuberosity. It's located on the tibia. Okay. Now, we'll look at the posterior surface here. Again, lateral now, medial. There's one major landmark to note, and you can kind of see it right here. It's this rough patch, it kind of starts laterally and courses medially. This is called the soleal line. Now, just so you don't mix it up and say the soleal line's on the femur, a good way to remember this is there's a muscle, a calf muscle, which is called the soleus. It's just deep to the gastrocnemius, and it's actually intimate to this bone right here. And when I say intimate, it's like attached roughly or very tightly on there, and it's attached along that line. So the soleus muscle is attached along the soleal line. Right, does that make sense? Now, we'll go back anteriorly, and we can see this little overhang, this little hard nodule right here. This bump is called the medial malleolus. And you can actually feel that on your ankle if you actually reach down medially. You can feel that bump. That's what's called the medial malleolus, meaning malleolus referring to hammer. And so that is the tibia. Easy enough. Move on to the fibula now, which is just lateral. There's just a few structures to be aware of on here. The first, the most proximal structure is the head of the fibula. This will actually articulate slightly with the femur, the lateral condyle of it. We then have the neck of the fibula, which is just distal to the head. Continue down the shaft of the fibula, all the way down to another protrusion, which is the lateral malleolus. So we have the medial malleolus on the tibia, lateral malleolus on the fibula. And this is helpful both ways. So it helps you to remember that the tibia is medial to the fibula because it has the medial malleolus, just like the fibula is lateral to the tibia because it has the lateral malleolus. So those are the leg bones. And we'll finish off looking at the foot tube. So unfortunately I don't have an appropriate, these should be, the fibula needs to be on the lateral side. But looking at the foot, and particularly we'll start with the ankle joint. Now, this first bone, you can see right here, and this is looking medially, from the medial side, medial direction. That's where the big toe is on the medial part. Is the talus bone. It's just right here. The talus bone is the most superior bone. It will actually articulate with the tibia and the fibula, and that's where all the force of your body comes down on, right on that joint, right on that bone. So it's an important one. Now we'll continue looking down, again from a medial direction, this being posterior, anterior. And we have a bone called the calcaneus. And it's pretty distinguishable because of this protuberance that's got sticking out back here. And of note on the calcaneus, on this little protuberance, is this rough patch way at the back. And that's another tuberosity. And this is called the calcaneal tuberosity. Partly because it's on the calcaneus, and partly because it actually attaches, or the calcaneal tendon attaches here. The calcaneal tendon is also more commonly known as the Achilles tendon, anatomically correct. That's what it'll go by, oftentimes, even clinical settings. And that's where the bone, or the muscles of the gastrocnemius, soleus, form a common tendon and attach posteriorly. So it's very important. Now, we'll continue moving on down. And these next bones, next set of tarsal bones, we'll look at the medial side right here. And this bone is called the navicular bone. It's kind of a thin rectangular bone on the medial side. We'll move laterally near this little toe, and you see more of a square bone. This is called the cuboid because it's more, I guess, squarish, so it's cube, sorry. Now we'll start to move medially again. And we have three little bones that are all mainly named the same thing, just directionally they're different. So the most lateral of these three bones is the lateral cuneiform bone. The middle one is the intermediate cuneiform. And then the most medial of these bones is the medial cuneiform. Does that make sense? Now, we're going to flip over real fast, and we're going to look from a plantar view of the foot. And this provides a little bit of a different look at things. So here we have the calcaneus, which is the most posterior part, again. Two important little structures on the calcaneus that we can see here. First, again, we're looking medially now. There's a little bump. This is called the sustentaculum tali. Right here. Just below that, we have a little ridge, and that's where, if you can see on the video, there's a little blue mark. There's a little screw in there, and the red part of my probe is running through it. It's a little ridge, a little groove. There's multiple tendon grooves on the bottom of the foot. This one is the groove for the tendon of the flexor hallucis longus muscle. So, a way to help remember this is flexion of the foot, if we look medially, is going to be like this. Extension will be this way. So your flexor muscles are going to be on the posterior side of the leg, and their tendons are going to run underneath the foot. So when that tendon or that muscle contracts, it flexes. So if you can imagine that tendon of the flexor hallucis, meaning the big toe right here, is coming underneath on the medial side, running all the way to the big toe. If that muscle contracts, that tendon's going to go up, and the big toe's going to flex. Okay? And then another final piece on the plantar surface of the foot. Again, we're looking laterally. So this lateral tarsal bone is going to be the cuboid, just a different view of it. And as you can see, it's got its own little tendon groove right here. And this is the groove for the tendon of the peroneus longus muscle. The peroneus longus is also called the fibularis longus because it runs laterally. As we can see, again, this is the lateral side of the foot, and that tendon will cut down this way, makes quite a drastic angle underneath the foot. Okay, so we're almost done, finishing off here. Now we're going to the metatarsals, and these, comprise really your toes, essentially. Now, or just close to your toes. Now, metatarsals are not very creatively named. They're named the first, second, third, fourth, and fifth metatarsal. First always being the most medial, and where the big toe or the great toe is the first metatarsal. First to fifth, medial to lateral. They're connected to these other little bones called phalanges. Now, phalanges, interesting thing about them, the first, they comprise what we call digits. So, first metatarsal, first digit. Second metatarsal, second digit. Third digit, fourth digit, fifth digit. If we get specific, each of these little bones, there's 3 of them on digits 2 through 5. There's 3 phalanges, a proximal, a middle, and a distal phalange. Phalanx, I'm sorry. The first digit, the big toe, only has 2 of these. This is the same way in the hand. You can only see a proximal and a distal phalanx of the first digit. So this oftentimes trips up students. If we are, say on a test, tag, you can see right here. I'm going to tag where that red probe is. Okay, so you look at this. Okay, you know it's a phalanx. It's the most proximal of these 3, so it's the proximal phalanx. And 1, 2, 3, okay, third digit. So that's the third, or the proximal phalanx of digit 3. That's how you would correctly name this. Whereas this metatarsal is not the third metatarsal of digit 3, or the metatarsal digit 3. It's its own separate bone, the third metatarsal. Again, if you have any questions, don't hesitate to ask one of your professors, one of your TAs, and feel free to please utilize this video and your self-check quizzes as much as possible.